in addition to that whole sort of digital transformation and consumer experience, I think one of the things that we see as uh, thematically um, that will thematically sort of impact everything is this migration of care to the home. So more broadly, it's transition in site of care. So you could say that, um, but more specifically, the transition of site of care or the migration of care to the home. That's a huge issue. The Medicare population is growing like crazy. Um, and as soon as there's an acute care event, an older senior finds themselves in a place where they hadn't necessarily been before, and they need all kinds of care. And and keeping that person in the hospital is not a good thing. So, and the truth is, they don't have to be in the hospital because they can be cared for at home. But orchestrating the care in the home is tricky, and it's not. It's one of these areas where um, our industry has not figured that out yet. Even though there's a lot of initiatives to care for people in the home, so there's hospital home, DME is becoming a bigger thing. RPM, you're monitoring patients in the home. Um, MTM, you're monitoring the adherence to drug therapy, and home care is kind of all of a sudden sexy again because of the fact that this is all happening. It goes on and on, but
Yeah.
um, the there are an increasing number of businesses that say, "I want to take risk for the post-acute care of a patient, and I'm going to do it by orchestrating and fine tuning the in-home care approach and having all those things sort of dovetail and work together." It's a fascinating area. So I would say one of our points of view is we really like that. We
Yeah.
really like that area. The other thing that I think about when you ask a question like that would be the use of data is just remarkably different these days than it's ever been because the release of interoperability requirements now and the release of the ability for consumer to sort of consent to the release of their own data for the
Yeah.
use in the health system, that's going to change everything. It's going to allow people to be more informed about uh, a patient's care and a patient's situation um, more completely. And then, um, of course, there's better and better tech, AI tech, and other tech that will allow the use of that data to be sort of synthesized in a way that's going to surface. It's going to surface issues. It's going to allow us to care for people in a sort of highly personalized manner, and it's going to enable providers and payers to be better at what they do. If if it's done properly, it's going to be remarkably different.
Yeah.
So, so those are some of the things that we think about as we look at the year in front of us.